Hello, this is Simon Downs, broadcasting from Tokyo, and this is the Med Student Lounge. And today we're going to talk with Lisa Cornforth, who will be talking about her visit to a conference on integrative medicine in Chicago, which was organized by students of 6 universities, and we're also visited by another distinguished panel member, and that is Wendy Chen. Wendy, would you like to introduce yourself?
Hi, um, I'm Wendy. I'm a fourth-year medical student. I'm working in rotations and a rotation in St. Louis right now, and I'm very interested in integrative medicine. So I'm pretty excited about listening to Lisa today.
Okay, thank you very much. Well, welcome, Wendy. And so, Lisa, would you like to introduce yourself?
Hi, I'm Lisa Cornforth, and I'm a second-year medical student at Oceania University, and I'm also an RN, and I'm excited to share with you all about the conference that I just attended, and I do hope to practice integrative medicine when I graduate, and that's why I took the time to add this to my education.
Thank you very much. Okay, if you would like to share your screen, and we'll start your presentation. Thank you.
Okay, I would like to start out by saying this is the first adventure for me by myself to fly to a big city. So I was pleased to find that I could relax in the airport here at a yoga room in the Chicago airport. So if you happen to be traveling there, this was a moment to just de-stress after the adventure. Um, it's nice that they provide that, and yoga is definitely something that helps me as a medical student to manage my stress, and I'm glad that I've added that at the advice of my advisor from OUM. I took this picture from the airplane coming in because it reminded me of a picture that I had seen hanging in the airport previously. And so just to show you the similarity, they have an exhibit that is in one of the hallways of the airport. And here is the image that it reminded me of. So this is if you don't know, a petri dish, and so this is showing bacteria that are traveling together in a group. So it was just funny that something from the view from the airplane, if you catch my drift of why that seemed familiar, back to the screen up here from my view from the airplane. Another interesting thing in the Chicago airport is they have a hydroponic growing area, and this is a new way of growing that my husband's actually involved in. And so I snapped these pictures for his benefit, but also it took me into the integrative medicine part of learning about how beneficial the foods that are now being incorporated into a lot of mainstream restaurants. And so each one of these pods where they're growing, there is the name of the restaurant, and I wish I had a pointer at the moment, but on the sign where it says the Genovese basil, it tells you what restaurant in the Chicago area is serving this. And so this is organically grown, and with the lighting, and it's pretty amazing that the Chicago airport has this going on. And just to show you another one from on the right is a version of cherry tomatoes, and then oregano. And then if you happen to be traveling in the Chicago airport, this is where you can hang out. And of course, I was studying for an exam while I was at the conference. And so this is a little known secret of a nice quiet place to, and this is actually right next to those plants that I just showed you. And this is in the A terminal. So if you can look straight across from where I took this picture, that is me getting off of the elevator. And so you are looking across over there at the plants. And then just to the right of that and all the way around the perimeter of this walkway are those comfy green chairs and little tables. So as I walked up there, I at first thought maybe I was intruding upon the staff, because it was mostly all pilots and the stewardess hanging out up there. But then I realized, no, it is for the general public too. So if you're traveling American Airlines, you'll easily find this. So not giving a plug for them, I'm just letting you know that it does make travel not quite so hectic. And so here's another one of my adventures by myself, was navigating public transportation. I found it to be really relaxing, again, to just sit on the train and enjoy the view going to downtown. And then I found the library in Chicago, another place that was nice to study, and this is on the 9th floor of the Chicago Library. And this is at my hotel. I'm at the Inn of Chicago, and they had a place for me to take study breaks while I was studying in my hotel room, and so I could go out there every half hour or so and walk around and enjoy the view. That was from getting onto the subway. But just some more view from my hotel. And then at the, well, this is the outside of the hotel. And this is a very, very old hotel in Chicago, but really wonderful place. My favorite speaker at the conference was Dr. Kurt Heinking, and he is a professor at the Osteopathic Medical School, which is it's called Midwestern, and it's in one of the suburbs of Chicago. And I was not familiar with some of these body techniques that a DO doctor performs. So I was pleased that he was willing to show some of the techniques that he uses with patients. This is one of his students. It wasn't that we as participants at the conference could have the body work done, but so this is a student who's doing an internship with him right now. And so they described the body work and some of the immediate benefits that a patient could have if waiting for a surgery, waiting for medication to take effect. I was pleased to find out how they could help patients in the hospital. And I've seen many DOs and taken my family members to see DOs and had never seen them do any of these techniques. So I do plan to try to find an opportunity to do a clinical rotation. There's a DO school starting in Arkansas where I live. I live in Bentonville, Arkansas, and they're opening a school in Fort Smith next year. Another speaker was Dr. Bob Rakowski. He does have a big following. He's from Houston, and he showed us some videos of patients that he had helped. He is a chiropractor, and I believe he has a radio show also. And then another speaker that was very influential to me was Dr. Sonia Oyola, and she talked a lot about practicing stress management while you're in medical school, and then to take those practices into our future as physicians, to be role models with our patients and to make that a primary focus with patients is stress management. And so I thought that was great information, great advice, that how we manage ourselves now will probably have a great influence on how we take care of ourselves when we are physicians. And Wendy, I'm sure I cannot even imagine how stressful it is for you in your clinical rotations right now, and finding time to recharge your battery. These are some of the students from the, as Simon said, there were 6 different medical schools represented at this conference, and I believe this was the 10th year for them to hold this conference in Chicago. And so if you want to be a part of the team for next year, they do invite anyone to be on the committee. And so these are the students who completely organized this entire conference. And this was held at Northwestern Medical School, and their facilities are wonderful. Of course, there's been other conferences put on by AMSA that are held at that facility also. And so these students had already been acquainted with the people that they invited to speak at the conference. So there was already a relationship that they had in inviting them. Some of the other speakers that were there that did breakout sessions was Dr. Gita Maker-Clark, who talked about the anti-inflammatory diet. Dr. Jason Ong, he talked about sleep disorders and some ways to manage insomnia with natural methods. Another doctor who is from the medical school called National University of Health Sciences, which is in downtown Chicago. Dr. Lorinda Sorensen talked about the clinical uses for ginger and turmeric that you can just buy from the grocery store. And she is one of the professors there in the program for a naturopathic degree. And there was a pretty large population of students from that university. And that was another one of the highlights. She's my second highest professor. I would love to just be able to take an online class if they had that, or possibly a weekend course if that university offered something. Other presenters were Ingrid Yang talked about yoga and how you could actually incorporate that into your clinical practice. Another one that I attended was about the human microbiome, and this is Dr. Judy Fulop, and she is a professor at Northwestern, and she was talking about the latest research in the friendly bacteria and how it is showing now that it is a genetic link. In other words, your microbiome would be similar to your mother's, your family, your ancestors, and that medications are influenced by the variety, and so the variety that you have, it's quite fascinating. That was a totally new subject to me. Another presenter talked about the philosophy and science of acupuncture, and that was put on by Dr. Leslie Smith. And a final speaker was Robert Ellis, who talked a lot about the philosophy of care and how medicine seems to be changing now with concierge medicine and affiliating with other physicians from a different viewpoint, as far as having in one practice having an acupuncturist, a DO, a chiropractor, a medical doctor, physical therapist, and trying to have a wide variety of practitioners within one practice. And that is part of my goal, is to try to have something like that. So at this time, I would welcome your questions.
Okay, thank you very much, Lisa. It's very interesting. Maybe I would start off with a question, if I may, about integrative medicine. You saying that you are interested in integrative medicine as a specialty. Why would you choose integrative medicine over other specialties?
Because it has helped me, and I would like to help my patients in the ways that things have helped me, and that has been something that is I was introduced to at least 15 years ago.
And do you see that integrative medicine will become more mainstream in future medicine in the U.S.?
I do think that that is what patients are looking for.
Mm-hmm.
And one of the opportunities that presented at this conference was Aurora, who was one of the sponsors. They have internships and residencies, so I was able to make a connection with them. And Northwestern also has a degree in integrative medicine.
I see,
Northwestern
wonderful.
has clinics with integrative medicine doctors.
Wow,
And
that's great.
the speaker, Dr. Sonia Oyola, she is a family practice physician at that integrative medicine clinic.
So it's a great time to be a medical student coming into this, that there are residencies opening up that will
Yes.
welcome students. Wendy, do you have any questions? I think you're muted.
Thank you, Lisa. That was really interesting to hear your experience with integrative medicine. Is there a particular modality that you're very interested in, or are you interested in like maybe having like an office where multiple modalities are available for your patients?
The one thing that has made a big difference for our family, and something that I used to do in a practice where I shared an office with another herbalist, it's called photonic therapy. And I learned about the meridians of acupuncture, and I internshipped with he was actually a veterinarian, and he invented a light that could be used on the acupuncture points on horses. And the reason he came up with this modality was to keep from being kicked by the horses. Just quite frankly, he had been using needles for many years. It's Dr. Brian McLaren. He's in Australia, and so he researched about this frequency is 660 nanometers, and it's just enough that you might look at it like it's a laser, but it's not, because that's in the visible frequency range of visible light. And yeah, so this is my 15th year to be involved in using this technique, and I definitely will plan to do that in the future. And the other things that I mentioned, prescribing herbs will be a part of my practice, and encouraging yoga and stress management.
I see. On the subject of stress management, in your presentation, you were talking about Wendy being in clinical rotations at the moment. I wonder if we could turn the discussion to Wendy and how she is able to release stress as a result of waking up at 4 a.m. and then returning at 9 a.m. What's your strategy, Wendy?
Well, at the moment I'm not doing a great job, but I do try to make sure that I exercise on a regular basis. Part of my stress relief is to cook and bake, so I have been baking some cakes and just being active. I think is probably one of the best things that I can encourage other people to do and encourage myself to do, is to not just sit down and study for 8 hours straight, and then you don't have any energy to do anything. You don't feel like doing anything, but to break it up, sit down, do something, go outside, breathe some fresh air, that sort of thing.
Yeah. The
Um,
things you're
and
talking about are things that where you're able to be in control of. Like when you bake a cake, you're creating something. Do you think it has to do with being in control of your environment? Whereas when you're a medical student, you have to do this, you have to do that, and you have to follow this regimen. Why is it that you would choose these type of activities?
um, I think the baking is more the being able to make something. So creating something that wasn't there before.
Okay.
I like art as well, so I like to
Okay.
paint and that sort of thing. But art takes a long time, and you have to have paints, and if there's any animals running around.
I see.
um, so I like that, and I also like interacting with people, so that when I'm done with baking the cake, I can give it to someone, and people usually really appreciative, and that
Yeah.
that I
People
like.
love cakes.
Um, Sure, being in control of a situation is very
Oh,
is helpful in the sense of kind of giving you some sort of um, I don't know, relief is not the right word, but some sort of uh, you know calmness in the sense that things are kind of going your way.
I
Um,
see.
but um, I think that there's something to be said with, as Lisa was mentioning, yoga or just taking time out for yourself. And there's so much going around you, and so much that's expected of you, and certainly as a medical student, so much that you have no idea either what is expected of you, or you're supposed to do something, but you're not sure how and why, and
Hmm.
just taking the time to take a deep breath and say, okay, this is all possible. People have done this before me,
Yeah.
and taking one step at a time. So remembering to to take that the calm yourself. That way you can focus on the you know craziness that's around you.
I see. Thank you. Yeah, that would be good advice for me. I'm not in that area yet. I'm still in the basic sciences, but I'm looking forward to that. I understand that both of you will also be attending another conference that's coming up very soon. Can you both say something about the conference you'll be attending next week? Maybe let's start with Lisa. Yeah.
Okay. We are going to Washington, D.C., and the first day that I arrive, we'll be doing a lobbying rallying at the Capitol. And so there will be a group of students from all over the world. The AMSA is not just the United States, and obviously the school we attend is an international school, but we're going to have an opportunity to meet with our representatives and senators and let them know what's important to medical students. And one of the things that we'll be emphasizing is the student loan debt. And there'll be some other things that we talk about. And then the rest of the weekend we will hear from the new um, Surgeon General, and he is the first keynote speaker. And then we'll have some other sessions where we'll be able to practice some clinical skills and just talk with other students from other universities, see the vendors, and um, the camaraderie is a big aspect of it for me. It keeps me motivated, and uh, just looking
Sounds
forward to.
interesting. Yeah. I wish I could go. That sounds great. But when do you have anything to add to that?
Um, Not much. I mean, that's pretty much the same for me. I think that probably the biggest thing for me is the camaraderie, the being there with other people, struggling with tests like I am, studying for the
Yeah.
exams that I am,
Hmm.
and talking to them about how they're studying. And some people are, willing to take time and study in the hallway, kind of stuff. So
Okay.
it's
Really? Wow.
yeah, it's very motivating in the sense that there's other people, striving for the same things you
Hmm.
are, wanting the same things for their patients as
FMLE. Right.
as you do. So it's very, some days when you're like, I can't do this anymore, this won't
Hmm.
work, just remember that other people are kind of struggling through the same thing. Also, there's, you can form friendships there and
Mhm.
talk, continue that friendship and kind of help each other through as you go through. Um, the I like that the convention sessions tend to be what's going on right now. So, for example, one of the big discussions right now is the unvaccination of kids, the kids that are not vaccinated, and
Mhm.
stemming from the recent outbreak in Disney World. Well, so what do
Yes.
we do with those kids? What do we do with those parents? Um, what's the best approach? There's been several physician offices that are no longer accepting um, people that are not vaccinated
Mhm.
because of the possibility that they can basically cause the entire office to shut down. One of the things that happened in California was that a family that was unvaccinated, multiple children, came into the waiting room, were ultimately diagnosed with measles. And
Uh-huh.
so they closed down. Not only did they quarantine all of the patients, but they quarantined the entire office, all the doctors, all the nurses. They all
Really?
had to be in basically house arrest for
Wow.
21 days. So when you start talking about not just getting sick, but now you're talking about affecting a doctor's office for 21 days. Can you imagine, your practice being shut down for 21 days? So
Mhm.
what does that look like, and how do we deal with that? And do we really tell people, oh, I'm not going to treat you? And so now what are we telling them? What kind of message are we sending? Or are we just farther pushing them away from from getting any sort of medical care versus
Mhm.
how do we talk to them? How do we work with them? Okay, they don't want this, but we can do these things to help them. That sort of, it's just a really interesting conversation, and that's just one topic that we'll be talking about there.
Wow.
So I always am very interested in
Mhm.
what they have to say and the kind of the discussions that they bring out up, that will definitely affect all of us, no matter where we practice in
Mhm.
the world, versus hospital office, that sort of
And
thing.
may I confirm the date of that conference, the AMSA? When is that?
It's February the 26th to March the 1st.
I see. And this is in Washington, D.C.
That's in Washington D.C. Yeah, they have one every year. It sounds like they alternate Washington D.C. with some other place every other year.
Wow, great that you guys are going together. We have to get
Yeah.
more.
Yes, it's very nice to have someone to go to all the places with, and
Yes.
sometimes we divide up. Okay, you go to that one, and I'll go to this one. The really
Yeah.
cool sessions that we both want to go to. So
Oh, it
very
sounds
Yeah.
good.
fun.
Yeah.
This will be my fifth adventure with
Really?
AMS. Hmm. Yep, and I I did the Seacouver study tour to Seattle and Vancouver
Oh,
last
that's great.
summer. They do have, besides the annual convention, they have mini conferences. So uh, Wendy and I also went to that one in the fall of last
Yeah, the
year.
leadership
Yes.
conference.
Yes.
Right.
I
Yeah.
remember that. That's great. Okay. Well, thank you very much. This has been a very, very interesting presentation on your conference in integrative medicine and also an introduction to the AMSA conference coming up in for February 26th to March 1st in Washington, D.C. And so we'll look forward to more med student lounge interactions with medical students from around the world. And so if you guys will stay on the line, I'm just going to say goodbye to the world. Okay, goodbye.